Hello, YouTubers. It's been a while since my last Burr-hole recovery video, and it's been, how would I say? It's been about a year and 2 months now. Yeah, since I had my Burr-hole procedure, and and now I can say I've had three CT scans also, and now the doctor has told me that everything is looking good and everything is going as it should. And my head is okay. Still have a little scar from it though. I don't know. I don't think it will show. My hair is growing back well. So, um, it's been a difficult journey actually because I actually had a this thing post-concussion syndrome, and it affected my recovery. I was feeling bad a lot and everything. I was for almost a couple of months. I kept on getting light sensitivity. I kept on getting feeling spaced out, like maybe I was intoxicated or something, and I was having these headaches and all these different things. But as time gradually went by and everything, it gradually came down. And also, there was this drug the doctor gave me, and I think they call it Elavil. It's amitriptyline. That's the name for it. It really helped me. Uh, I don't know, but immediately after I started taking that, my head just started reorganizing itself, and everything just became much better for me. And now my head barely registers. I still get a little pressure from here, yeah, but it's nothing any significant anymore. It's like greatly reduced compared to the last time and stuff of the things I went through. So now uh, my recovery is okay. There's nothing wrong with me. My head is healed properly, and I think that's about it. So I feel a lot better. I haven't even seen the neurosurgeon in a long time because what they say, the other doctors were able to read the CT scan and tell him everything was okay. And I actually, he was in Germany at the time, so I actually sent him some of my pictures I sent him the CT scan and what do they call it, and the doctor, what the technician there wrote about it and everything. He said everything is fine. But what really got to me was I was really scared at the time because the post concussion syndrome made me was still giving me the symptoms for the GERD. No, sorry for so for still giving me the symptoms for the Burr-hole thing. I get the headaches, I get the light sensitivity, I get the drowsiness. I wouldn't be able to get up. I'll start feeling sick, but I'm not really sick. It's like I'm about to fall sick, but I'm not really getting there. So that really changed my what they call it. Like I didn't know what was going on at the time until finally after the second CT he looked at it, and when he looked at when he saw he finally got back to me and told me that he doesn't see anything wrong physically, but he thinks I have post concussion syndrome. That's what the neurosurgeon said, and I should see a neurologist about that. I saw a neurologist about that, and he he just what I say he was very he gave me he gave me some tryptazole drugs and stuff like that first, but I hate those. I hated that it was interfering with my thinking process and everything. So I was just and I didn't get too much of it because it's very controlled. So later along the line, um, I couldn't. It was another doc. When I went to the hospital, I saw another doctor, and I explained to him that, look, I told the other doctor I'm still getting these problems, and this is. He just said, okay, he's gonna give me something. I told him, and I couldn't. Another thing, sorry, I couldn't sleep. Remember, I talked about that in my last video. Like I had to be put on diazepam and amitriptyline on different occasions, at different times though. But I'm off them now. I'm sleeping fine now and everything. But during then, I would just lay down there for hours. I couldn't get, so I had to start taking the amitriptyline. But immediately I started taking the amitriptyline, the next day I felt different. Yeah, different. I felt stronger. I felt a lot of different things. But the amitriptyline could have been, but the neurologist also thinks there are a lot of things that added to my complications where I was feeling afterwards, like depression from the trauma I went through and everything. And the guy is in prison now, the guy that attacked me actually. So I don't even have any anger towards him anymore, man. I just hope he finds balance and be able to center his life around something that is worthwhile, because he's also having another case now which he defrauded a woman out of money. So that's his problem anyway. But I don't have, I'm not holding that anger towards him anymore. I'm trying to move on with my life. Actually, right now, the reason you heard me slip and say GERD is because go, I'm about to, I'm actually about to have a laparoscopic fundoplication done in a couple of days, and another surgery, just two surgeries in 2 years. But that one has been disturbing me even before the brain thing. And now that I look back towards it, I see like a lot of the symptoms that I mistook for my head was actually my GERD at the time, like the uh, nausea and stuff like that. That one was the GERD, and I still get it now. So, but there's something I noticed that before all this change, like when I put my head, like when I get my head and when my head starts pressure, that's when I feel the thing. It even caused problems for me. When it really starts, I don't even feel hungry at the time. So when it started, that was like this. I'm talking about a couple of months ago, not now. So when that happened, I will now feel. I'll feel the what they call it. I can't eat, and that actually caused so much acid to build up, and I got esophagitis, and I couldn't eat anything, and I had to be admitted in the hospital, and the same hospital I got my brain surgery, and they had to put intravenous drip for me until the acid from my esophagus healed from the acid damage. So now I had an endoscopy done, and they're telling me now that uh, I need surgery because my teeth, I even you can see, that's not completely due to being attacked. Actually, that's completely partly to my GERD symptoms. I've never seen that. Even when immediately the gastro doctor saw me, he immediately saw my teeth. He said I have GERD. So I was even surprised the minute because I hadn't told him what was wrong with me yet, but he was a stomach doctor and everything. So I'm just now trying to get myself mentally ready for the laparoscopic procedure. Like a lot of people have been reading up about it. A lot of people have been telling me a lot of things. Some people they don't work for. Some people create more complications. Some people actually it work wonders for them. So I'm I don't really have a choice now because I've tried everything. So just decided it's the best thing to go ahead with the procedure anyway. And if you're interested in that, I'm gonna start posting up about it. Maybe I'm supposed to the surgery's supposed to be set. I'm supposed to go into the hospital on Friday. It's set for Saturday, but I'm not really sure. But he's telling me because of the COVID stuff, he's telling me maybe he might postpone it. So I'm not really sure that I'll be going in. But you can rest assured the day before if you are interested in knowing how that happens and the procedures and the recovery and everything about that, because I don't see too much about that on YouTube. Like I said, the reason I do this is because when I was going through my Burr-hole procedure, and everything. I was looking for people who had gone through it and get something from them, like what to expect, and I couldn't find anything. So I decided, okay, let me put this up for somebody that's getting ready to do these kind of things. So if you are contemplating about borehole, about sorry again, GERD or the laparoscopic fundoplication and anything like that, I think that maybe you would want to check it out in the future when I post it. But overall, on the borehole, let me get back to the topic at hand. I feel great. I'm actually day to day, day by day, I can feel it reducing. The post-concussion syndrome now is practically gone. Uh, I'm fine. I'm healthy. I'm not. So actually, my glasses. I remember I said I think my glasses had problems. The prescription. It wasn't that. It was the post-concussion syndrome that was actually messing up with my head and everything. Getting ocular pressure in my head, and all these different kind of things. But it's all good now. I don't get that anymore. I'm actually fine. I'm about to go out and stuff. I'm about to get. I feel like getting some chicken because I haven't really eaten anything, and chicken doesn't really affect the GERD. So I'm just thinking about getting some shredded chicken now. That's what actually I decided to do this video first. So I hope, and actually, um, what I realized now is like a lot of the symptoms I felt were were temporary, and I overreacted about a lot of stuff because when I look at the video now, I'm like, oh my god, I hope I didn't scare these people what I'm saying and all stuff like that. Like I'm so scared. Like it's excruciating. I was talking about excruciating pain and stuff like that, but actually, I think because I do have a bit of anxiety and stuff, so maybe that was part of it. So please don't get too worked up from everything you saw and what I said before about it. I actually feel great now. We even had a couple of fights with the Dr. Jimo sometimes because of I kept on bugging him. I'm not feeling good. I'm not feeling that. I'm feeling this, and he said, "Look, I checked everything, done everything. I don't see anything wrong. You need to see a psychologist or a neurologist or something like that." And at the end of the day, that ended up being the best thing for me because they figured out I had post-concussion syndrome. That's actually when you have concussion from traumatic head injury, but there's a certain of time that concussion is meant to last for. If the concussion goes any longer than that, then it becomes what do they call it? Post-concussion syndrome. Yeah. So if you have, I think there's a certain of maybe 2 to 3 months. If your concussion doesn't clear back by then you have the post-concussion syndrome. It's not really known what causes it to last that long and stuff like that. But it's never permanent. It has never been recorded to be permanent. Highest, I think, what I read it up on the Google, highest what the longest it lasts is 5 years. It's a long time, but mine is gone after a year, so I'm okay. So I'm actually think I'm strong enough now to for my laparoscopic fundoplication and everything, and I'm back to almost 100% in terms of my head. It's just my GERD now, so that's what I'm about to face now anyway. So something I want to document also because I see there's not a lot of videos about that too, and there are a few, but everybody has different experience, and I just thought it'd be nice to have a wider range of varieties for somebody that's thinking about getting the surgery. So maybe I might have maybe our bodies I might be more compatible. So if I have symptoms that I talk about, maybe they might be the symptoms you might have, they might not be, but at least you have a more wider from because what I noticed that everybody have different opinions about the laparoscopic fundoplication. Some people have what did they say negative stuff about it. Some people have positive stuff about it, and maybe like even when you're doing uh, research or something, you try get data from as much people as possible. So I'm going to put in that up soon. I'm going to start the procedure a night before the surgery starts. So pray for me, wish me good luck, whatever. But that's something I'll be doing soon, and I hope you all are okay and staying safe from this COVID shit. That's one of the reasons I had to delay the laparoscopic procedure actually because nobody was sure what was going on at the time this COVID stuff. So just stay safe, have a great time, don't get into anything that get you messed up, and take care of your bodies. That's all I have to say at my age now. all the problems I'm receiving from my Burr-hole to my hiatal hernia. Actually, that's what I have. So it's just different. It's just one thing or the other, and I've realized because I haven't been taking very good care of myself when I was younger. So I think that's just part of the thing that is creeping up on me now and everything. But overall, I can say half of my problems are gone because my head no longer bugs me anymore, and I've gotten my sleep back and a few other things. I haven't forget I had head surgery. Now I don't take any. The only problem is I didn't have blood pressure before, and now I do. Yeah, I take Endurel and actually take two drugs actually, diuretics and propanol, propanol. Sorry. So that's something I don't know whether it's from the blood pressure. Remember, I had it before I went in for the surgery, and I didn't know, and maybe the surgery was what brought it out to light. The blood pressure, I mean. So I don't know about that. So I just wanted to post this up a 1 year, 2 months update so that you would know how I'm feeling. Like some maybe thought I died or something, but no, I'm okay. Been taking time. I haven't worked. I haven't done anything. Trying to recover, and I think this time in my life is just a time I use for healing. This year and next year, and get my self ready for whatever step I'm gonna take next. So stay safe and have a great day. Catch you guys later.